The 10th season of Consider This is brought to you in part by From the Top, a national program showcasing the musical talents of young people. From the Top can be heard on KVNO Classical 90.7 each Saturday at 6 p.m.
Consider This, a program of issues and information behind today's news. Once again, from the campus of the University of Nebraska at Omaha, here is your host, Andrea McMaster.
Hello everyone, I'm Andrea McMaster and thank you for joining us for this edition of Consider This. Fighting to save lives, ensure quality care for all, and energize science to find a cure for breast cancer. That is the mission of the Susan G. Komen Foundation for the Cure Foundation. As the national group begins to celebrate its 25th anniversary, the Nebraska affiliate is stronger than ever and is making strides for the better. This week on Consider This, we are focusing on breast cancer, the second leading cause of cancer deaths among women. I have three guests I want to introduce you to. Lynette Farhart, who is the executive director of the Susan G. Komen Foundation, the Nebraska affiliate. And Lynette started as a volunteer for the Race for the Cure in 1995 and was hired 3 years ago to run the chapter office. So we're glad to have you with us today, Lynette. And Dr. Robert Langdon, who is the medical director of the Methodist Cancer Center and also a clinical assistant professor at Creighton University and the University of Nebraska College of Medicine. So we're glad to have you with us as well.
Glad to be here.
And Kate Summer, who is a breast cancer survivor, and so glad that you can come and share your story as well. You were also very instrumental in helping start the Nebraska affiliate of the Komen Foundation, and recently the recipient of some prestigious volunteer recognition awards. So congratulations on those, and glad to have you here.
Thank you.
Now, as we talk about breast cancer, the breast cancer death rates continually decrease as the years go on. So that's been happening since the 1990s. So we do have more breast cancer survivors living today, which is very encouraging. But I want you to start by just sharing your story of finding out when you first were diagnosed with breast cancer.
Well, 20 years ago, I had just had a baby, and I felt a lump, and when I went to see my doctor, he assured me that it was a clogged milk duct, and I was too young to have breast cancer. So I went back a second time and got the same scenario, and the third time I happened to notice a puckering in my breast and thought, you know, something's not right here. So I made an appointment, went back. At that point he took a look, left the room, called for a mammogram, and just bam, 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 I was diagnosed with breast cancer within 3 days. So it was, I was 30 years old. I had a almost 1 month old child and a 5-year-old daughter, so it was devastating. I didn't know that women got breast cancer at 30. It just wasn't on my radar. It wasn't in my frame of reference what breast cancer was. But I learned very, very quickly what breast cancer was. I had a bilateral mastectomy, followed up with chemotherapy and breast reconstruction, and then went back on with my life and felt very grateful that I was alive, and had a recurrence 5 years later, and same breast. And at that point I had radiation and then was put on a drug called tamoxifen. And that one was harder because my body betrayed me once again, and I thought I'd been doing everything I was supposed to be doing so that I wouldn't have a recurrence. So it's a mental regrouping and emotional regrouping that takes a little while, but it also got me kind of fired up about wanting this disease to be gone, to be cured, and so I started volunteering for the Komen Foundation. And it's been a great experience ever since.
And today you're doing well.
I am 20 years out, yes, cancer-free.
Continuing every day having to take a supplement,
I've been taking tamoxifen for 15 years, and Dr. Langdon could explain more about what that does, but yes.
But besides that, your life is as normal as it can be.
As normal as it can be, yes.
But knowing that having breast cancer really has changed you, besides just giving you just really a heart and a passion for finding a cure, it changed your life altogether.
It changes your life. You have to decide to really try to live your life as well as you can, because there are no guarantees. You do face your mortality. There is a loss of innocence about, oh, I could live forever, because once something like cancer touches you, you realize that really it could come back, and it does kill women. It does kill women. So it's there, but it's so much less there than it was at the beginning. When I go see Dr. Langdon every 6 months, about a week before, I start to get a little unnerved that maybe he's going to find something, and then I gleefully walk out of there and think yes, and then I kind of put it in the back of my mind and go on with my life.
Well, the Susan G. Komen Foundation, the Nebraska affiliate, is really a chance for people like Kate who have that passion, want to do something, and want to help find a cure. So tell us a little bit about how the national chapter got started, Lynette.
The national chapter was started because of a promise between two sisters. Susie Komen was diagnosed with breast cancer at a very young age, and she died at the age of 36. Her older sister promised her as her dying wish that she would do something about it. And so the way Nancy tells the story, she started with the shoebox full of names, and she asked her husband if it was okay to proceed with this project, and he said, that's fine, but just don't call any of my business associates or friends. And she said the next day after he left for work, she called all of them. And so she started this amazing foundation, and truly it has saved millions of lives.
And talk about the Nebraska chapter. I've heard people say that it's one of the strongest chapters in the nation, and that there's a lot of people behind it and involved. So talk a little bit about what you do and the mission here and the goals here.
Well, thanks to Kate, 14 years ago, they decided to have a race here in Nebraska. And for several years, we operated just as a race. And in 2002, once again, Kate pushed our local affiliate to become an affiliate and to serve all of the women of Nebraska. And so primarily we raise money. We have several fundraisers. We have lots of organizations that also have fundraisers for us. And throughout the year, as we're raising money, we're also granting out for education, screening, and treatment to the women of Nebraska. Additionally, we give 25% of our proceeds back to the National Foundation so that they can grant out research grants.
And even though you haven't had a personal battle with cancer, this has become very meaningful to you.
The very first race I was at in 1996, I went to watch the beginning of the race. The Race for the Cure is our signature event, and someone said you have to watch the race go off. And so I ran over to the starting line, and there was a little girl, probably 3 years old, and she had a banner taped to her back that said, "In memory of my mom." And I'll never forget that. And I cried the rest of the day, and I thought, that is so wrong. I had a newborn at home, and I thought, what would happen if this were me? And so ever since then, I became involved, and I've had a great mentor, Kate, who has really shown me what it means to be involved in an organization like this and what a difference we can make.
Wonderful. Okay, Dr. Langdon, I'm going to have you talk a little bit about the technical aspect of breast cancer, but first I want you to talk about what are the chances of survival. We mentioned before that we're seeing more and more breast cancer survivors.
Yeah, we are, and what's encouraging is the absolute death rate from breast cancer is actually going down, and it's really a combination of things. It's early detection and it's through mammography and self-examination, but particularly mammography and more recently with MRI of the breast for premenopausal women, we're able to detect breast cancers earlier, and those women will have a higher chance of survival just because they're in an earlier stage. It hasn't had the chance to really spread and become the lethal type of disease they can be. So that's a very important thing. Now, one of the things that's a little discouraging and we have to watch out for is the actual rate of women getting mammograms has been going up for a number of years, except for the last 2 years on a national level is beginning to taper off a little bit, and actually has gone down in some communities. And I think it's a complacency that women will have to not fall into, because that's a big part of improving the overall survival rate. The other prong of the improvement is actually treatment's gotten better. The adjuvant treatments, chemotherapy and hormonal therapy like tamoxifen, or more recently for postmenopausal women who stopped having their periods, that they would use an aromatase inhibitor, and those treatments have actually resulted in a higher cure rate. And the drugs have gotten better. The support drugs in terms of preventing nausea and some of the other side effects have gotten better. And so the ability to get women through those type of treatments is really improved. And then finally, we are seeing that there are some new drugs that work differently than traditional chemotherapy. They're referred to as targeted therapies. And it looks like for women who unfortunately we may not cure, but whom have metastatic disease, we may be able to keep their disease more chronic for longer periods of time. And these drugs work through by turning off certain growth factors, signals that cells have to tell other cells that they need to grow. And by turning off those growth factors, we can make cancer more dormant in a slower growing process, a more indolent or less lethal process. And so it's a combination of all those things that is really improving the situation of breast cancer.
Okay, I want to focus on a couple of things that you mentioned here. Mammograms and getting women to do the screenings. Is that one of the one of the ways that you detect breast cancer?
That's exactly
one of the largest ways is what I'm getting.
Exactly, and it's probably the beyond the physical examination. What the mammogram can do is it can pick up areas of breast cancer that are too small to feel, and it's through it's a radiograph. And it is through this radiograph of the breast that you can see either calcifications or you can see structures, a density that may be too small to feel. And and they've been available now for 20 years, and so the radiologists have become very adept at being able to tell what should be biopsied and what shouldn't be biopsied. And it's through that then a subsequent biopsy that tells a person that they have the cancer.
And we're starting to hear about digital mammography.
Right. The technology has improved. And you get into very technical aspects of how photographs are taken in a sense, and the same goes with X-ray. But much like digital has come into the movies and has come into all sorts of video, it's just a sharper picture. And so the detail of the mammogram is somewhat better with digital mammography, and most of the units here in this region are being switched over to that type of technology.
This is how these types of screenings, though, is how most of the breast cancer cases are caught, or is it the self-exams of women doing at home? I mean, how critical is that as well?
It's still very critical, because mammograms will still miss roughly 15% of breast cancers, and so you still need to do monthly self-exams, and women should have an annual exam and have their breasts examined by a physician or other healthcare professional at least on a yearly basis.
Okay. What are some of the risk factors of breast cancer?
Well, there's several. The family history, a strong family history, is probably one of the biggest risk factors, and there's about 5% of breast cancers are actually, we've been able to identify the gene. You can carry a gene within the family that predicts for a very high risk of breast cancer. And so if a person has a very strong family history, a first-degree relative that had breast cancer at an early age, this type of genetic testing would become a possibility to...
So for Kate's family, for example, just...
Exactly. And I believe your family has
We did go through, but we did not. We tested negative for the gene.
Okay.
The other risk factors, obesity, high fatty diet is a risk factor. Delayed childbirth is somewhat of a risk factor. So there's a number of lifestyle issues and just other health issues that can put a person at higher risk. And probably the thing to do is to pay attention to exercise, a low-fat diet, and then pay attention to doing self-exams and really having that annual checkup.
Mm-hmm. I think that's what I was going to get at next. Lots of women want to know, how can I cut down my risk for breast cancer? And we hear about diet and we hear about exercise. We also hear in the news that breastfeeding can help.
That's correct.
So, is that true?
That's true.
Okay. Talk a little bit about the variety of treatment options. I know you went through some of those here, but talk about there's the chemotherapy, the hormone therapy, and it seems like it's so individualized, I guess, today, the treatment options for women.
It really is, and the treatment is really stage by stage. And so for some women, if breast cancer is caught very early and it's small and there's no lymph node involvement, there's a procedure now in which a lump is removed, and then they can check what they call a sentinel lymph node, which they inject some dye, radioactive dye, and sometimes a dye that's blue that will go to that first node, which is referred to as the sentinel node. And if that's negative and you have a very small tumor, a person may only need to have radiation to the rest of the intact breast, or if they chose a mastectomy, just having the surgery alone. And so those would be a treatment option for early breast cancer. For women who have a tumor that's larger than a centimeter or has some lymph node involvement, most often they'll need either hormonal or chemotherapy, and that depends on the characteristics of the cancer itself, whether or not it has something called the estrogen and progesterone receptor, which is a protein which in the cancer cell itself will help make that determination. Some women would benefit from both, and so that is very individualized, and you have to take a lot of things into consideration. You take the size of the tumor, whether or not there's lymph node involvement, and whether or not some other key features like the estrogen receptors. There's also a gene called the HER2/neu gene, which is overexpressed in about 20% of breast cancers, meaning that there's extra copies of that gene, and that gene has to do with a growth factor. And if for women who actually have that type of breast cancer that overexpresses that gene, there's an antibody called Herceptin that is useful in helping prevent recurrences from the breast cancer. And so, and in a setting where there's local regional breast cancer, meaning it's confined to the breast or just confined to the breast and the lymph nodes, the goals with those extra therapies, which would be radiation, chemotherapy, or hormonal therapy, are to try to increase their chances of cure. So the goal there is cure. Unfortunately, if the breast cancer has moved to some other part of the body, most of the time it's going to be a situation where you have to try to control the disease to keep it from growing and causing more problems. And those treatments would also include the possibilities of radiation therapy, chemotherapy, or the hormonal therapies if the estrogen and progesterone receptors are present in those.
And how often does that happen, that breast cancer?
Well, it
spreads.
It spreads beyond, it's fortunately the minority of patients, but it's still in the range of, and it depends again on the original stage, meaning how extensive it was at the time of the first diagnosis that you may find it later. But we still see somewhere around 20%, 25% of patients that ultimately develop metastatic disease, and it turns into more of a chronic illness, or in some women, unfortunately, a very aggressive illness that can take their life in a short period of time. So.
Okay. Well, Kate mentioned that she's taking tamoxifen. Talk a little bit about what that is. I mean, she's been taking it for 15 years, so.
For people who've had metastatic, have had a recurrence, and so it's recurred, it can be useful in terms of controlling those cells if there's any left behind. Now, she's been out long enough that there's really no way of knowing how long she should really stay on it. But in general, patients who've had some spread to particularly the distal part of the body, the hormonal therapies, if it's hormonally responsive, may be able to control it for quite some time, on the order of years. Average times are usually on the order of a year or two, but fortunately some of these cancers are very sensitive to suppression with these medicines.
And there must not be a lot of side effects.
Not really. No, not really.
Because you hear about a number of women taking it.
No, the weight gain and hot flashes and things, not really.
Okay.
It's been pretty benign.
Okay, well that's good. Good to hear. I want to talk a little bit about support groups, and I think, Kate, you can probably chime in here too, but do you recommend that for women, Dr. Langdon, when?
Oh, I would. I think, some people get support from groups, some people have like individual counseling, people have, depending on their faith, and that's a lot of people turn to religious to give them support. Family and close friends, of course, are extremely important in terms of support, but we do encourage that patients to be open about their diagnosis and to try to seek out whichever modes of support are most beneficial to them. And at our cancer centers, we offer emotional counseling and support groups universally, and we talk about them on a very regular basis to patients.
Just highlighting on that, remembering about 20 years ago, really before the Susan G. Komen Foundation was started, people didn't want to talk about breast cancer just because it had to deal with the breast. And so it was a type of cancer that a lot of people didn't talk about. So the support systems weren't really in place as much as they are today. But talk about how that helped you, Kate.
Well, there was a program through the American Cancer Society called Reach to Recovery, and there are volunteers who go in to speak to a woman who has been newly diagnosed. And luckily, I had a Reach to Recovery volunteer at the hospital that I was at who was fabulous, because I saw somebody who had had the surgery, had gone on with her life, was working, and it was such a benefit. Then I became a Reach to Recovery volunteer and went out and met with women. And there are also the hospitals at that time were just beginning support groups for breast cancer patients, specifically breast cancer. And it's great because you're looking at a person who has literally been through what you've been through. And even though your family's fabulous or your friends are great and everybody's trying to be supportive and helpful, when you're talking to somebody who's actually gone through it, lived through it, on the other side of it, it's so empowering. It's so helpful.
How common is reoccurrence, like in Kate's case?
Well, again, the risk it depends on how extensive it was at the time of diagnosis, and so the risk goes up with more extensive disease. And by that I mean larger tumor size, whether or not there's lymph nodes involved, and how many lymph nodes involved, and that sort of thing. For women who are fortunate enough to have it diagnosed very early, less than a centimeter, no lymph node involvement, generally the risk is going to be 10% or less in those individuals. But if somebody has either not found or neglected a mass, and it grows to a size of 5 centimeters, which would be like a baseball size, and there's multiple lymph nodes involved, in the risk of recurrence may be as high as 80-90%. And so it's again, I think the vigilance of trying to take care of oneself and look for early detection is very, very important.
Okay. Let's highlight some of the latest research. When you're asked, will we see a cure in your lifetime, how do you answer that question?
Well, I think, for cancer in general, and breast cancer very much in particular, the hope and the stated national goal is to convert these cancers into chronic illnesses, if you can't cure them by early detection or early interventions, by the year of 2015, which is a very aggressive goal. I'm not sure we're going to quite get there by 2015. Part of it is funding. The National Cancer Institute's funds have been frozen for the last few years, and so our research, even though people are clamoring for it, we're having more difficulty getting cutting-edge research done. But what is being done is a process by which medicines are being developed that will have the potential of controlling even metastatic disease to the point where you may not cure the cancer, but you can live with the cancer, and it may not be what shortens a person's life. And that's probably the most realistic goal. And I suspect that there's a good chance that will occur within my lifetime and your lifetime. So I would be optimistic, but I do think not trying to be political, but the point is it's going to come through research, and I think that's what the Komen Society has very much pushed, both at a local level and a national level. Of the funds that the volunteers raise here in Nebraska, 75% stays in Nebraska for Nebraska programs that has to do with education, treatment, and a number of other aspects of that. And the continuation of people's willingness to give that type of money is going to it makes a difference.
Did you want to add anything to that, Lynette?
Last year, on a national level, the Komen Foundation granted $87 million to research.
Wow.
So they really are the world's largest nonprofit funding for breast cancer research.
Okay. Thinking about the women viewers who are watching today, I would like you and Kate to just point out what you really want women to take away from this show, what that you want them to hear, whether it's, make sure you are very diligent about getting your screenings, or I guess if a woman is newly diagnosed with breast cancer, what would you want them to hear from you?
There is life after breast cancer, a great life after breast cancer, a great quality of life after breast cancer, and go and get a mammogram once a year. Take care of yourself, empower yourself. You're responsible for your body, so you need to take care of it and make sure you're doing what you're supposed to be doing.
I think about that with women. We often hear, we are the caregivers for everybody in our family, and we don't often take care of our health. That women don't go in to see the doctor. They don't think about themselves until something critical is happening, because we're so focused on others in our life. So I guess that is a message just to make sure to send out to women, to make sure to take that time yearly. And I guess we can have you highlight a little bit, Dr. Langman, about when that you should start getting screenings.
Well, unless if there's a strong family history, then the genetic question, you start earlier. But if there is not a strong family history for the general population, so to speak, the American Cancer Society recommends mammography starting at age 40 and annual exams. I think the time to really, I think women, it's good to get comfortable at examining your own breast, and really as soon as menarche occurs, to begin to know your own body and to do monthly exams, and often has been suggested to do it at the end of a period, and get into that habit of doing an exam, for example, in the shower. And there's certainly abundant literature, both from the Komen Society and the American Cancer Society, in terms of how to do breast self-exams, and I think every woman should familiarize themselves with that, and then and pay attention to the screening process once you get of that age.
Okay. Well, I want to mention the website, www.komennebraska.org, where they can find a lot of information. And there is on there how to do a screening. It shows even a video, I think, to help women along. So talk a little bit, we only have about a minute left, about Race for the Cure, the next one that's coming up. And you're always seeking volunteers, and of course, you're always seeking funding.
That's correct. October 7th, Sunday morning, 8 a.m. at the Omaha Civic Auditorium. And we're expecting 15,000 people there this year, and it's a wonderful event. You can go to KomenNebraska.org by the end of the month to register for the race.
Thank you so much. And thank you for joining us for this week's
program
Consider
produced
This.
by UNO Television. More information and program archives can be found at unotv.unomaha.edu. If you'd like to share your comments about this show, call UNO TV at 402-554-2516 during regular business hours.
The 10th season of Consider This is brought to you in part by From the Top, a national program showcasing the musical talents of young people. From the Top can be heard on KVNO Classical 90.7 each Saturday at 6 p.m.